cardiac surgeon in operating room 3 calls the time of death. The monitors go flat. The team steps back. And then, 8 minutes later, the patient comes back and begins describing the ceiling lamp above the table from an angle no one lying on that table could ever see. This is not one story. Versions of it have been reported thousands of times, across cultures, across continents, across people who had never compared notes. Near-death experiences, NDEs, have been documented in peer-reviewed medical literature since at least the 1970s, when psychiatrist Raymond Moody published his landmark research compiling over 150 accounts from people who had been resuscitated after clinical death. What startled researchers wasn't just that people were having experiences. It was that the experiences were consistent in ways that seemed almost impossible to explain. The tunnel of light, the sensation of leaving the body, encountering deceased relatives, a life review experienced not as memory, but as full immersion, and in many documented cases, a vantage point above the room that matched physical details the patient could not have observed while unconscious and flat. One of the most cited cases in the research literature involves a woman referred to as Maria in a 1989 paper by social worker Kimberly Clark Sharp. Maria reportedly had a cardiac arrest at a Seattle hospital, was resuscitated, and then described floating out of her body and drifting outside the building, where she reported seeing a specific tennis shoe on a third-floor window ledge. Sharp investigated and, according to her published account, located the shoe exactly where Maria described it, in a position not visible from any window accessible to the patient. This case is frequently cited as compelling. It is also, it must be said, a reported account, not independently replicated under controlled conditions. That distinction matters, because the honest picture here has two sides. On one side, there are serious researchers. The AWARE study, Awareness During Resuscitation, led by Dr. Sam Parney at Southampton University, attempted to test out-of-body claims under controlled hospital conditions by placing visual targets on high shelves, visible only from above. After years of data collection, only one patient reported a verifiable out-of-body experience, and in that case the target was not confirmed. Parnia has been careful not to overclaim, but he has also stated publicly that the study revealed cardiac arrest patients are experiencing something, and that current neuroscience does not fully account for it. On the other side, neurologists point to oxygen deprivation, REM intrusion, and the brain's documented tendency to generate vivid hallucinations under extreme physiological stress. A landmark study published in the Proceedings of the National Academy of Sciences found surges of gamma-wave activity in the brains of rats in the moments after cardiac arrest, suggesting the dying brain may be capable of generating intense, ordered experiences even as the body shuts down. So which is it? A neurological artifact of a brain in crisis? Or something the brain is receiving rather than generating? Here is what remains genuinely unresolved: the consistency across cultures, the verified perceptual details in a small number of cases, the patients who return describing conversations that later check out, or identifying people in the room they had never met. None of this has been systematically faked. None of it has been systematically proven. What we are left with are thousands of human beings who experienced something so profound it changed how they live, and a scientific community still working out whether that something came from inside the dying mind or from somewhere it hasn't mapped yet.